All right, now this is the third section that we're going to take a look at here. It's called the basically everything else is left. We're going to talk about the integumentary system. We're going to talk about positional terms. We're going to talk about the urogenital system a little bit. These are all the parts that we haven't covered yet, so this is what we're doing now. First thing we're going to talk about is the integumentary system. What do you think the integumentary system is? Well, by looking at that picture, it's actually your skin. It's the largest organ in your body. We need to take care of our skin. It is an organ. It can get damaged. If it gets damaged, other organs fail. You cut yourself real bad, you can bleed to death. You burn yourself real bad, you can die from infection. The skin keeps the bad stuff out and it keeps the good stuff in. It keeps water in, it keeps water out. It does everything that we need to do to act as a protective barrier, and it's really pretty amazing organ when you think about it. The skin and its derivatives, your hair, your nails, your sweat, and your oil glands, make up the integumentary system. Everything that's embedded in the skin is part of the integumentary system. It protects the body from external factors such as bacteria, chemicals, and temperature. It protects the outside stuff that shouldn't get in from getting in. This is actually a section of your skin right here. We have two parts to your skin. We've got the epidermis, which is all right here, and the dermis. The epidermis, if you're looking at somebody's skin, you'd be like, hey, baby, nice epidermis. It's actually dead tissue. Okay, creeper. You're looking at their dead tissue. All right, but their hair and their skin is actually dead tissue. The living skin is the epidermis, which is down here, and this is where all the organs exist. You got sweat glands. You notice you got blood vessels coming in and out. You've got nerve endings coming in and out. Believe it or not, every single muscle or every single hair in your body has a muscle attached to it. It's called the erector pili muscle. Uh, you got hair shafts coming out. All this stuff on the lower part is the dermis. Then below that, we have subcutaneous tissue, which is like muscle or whatever is below the dermis. There's not a clearly defined structure between these two, but here there actually is a pretty clearly defined structure. You can see the difference, especially if you look at it under a microscope. All right, so how do we evaluate it? There's certain things that we look for. Pale. If they are not as the normal flushed color that they are, if they're a whitish color, that's what we call pale. Cyanosis. Are they bluish? That means that they're usually cold or they're not getting enough oxygen, but it means there's not enough red blood cells circulating, so skin takes on this bluish tint. If they're too much blood flowing, they can take on this reddish or flush tint. This can indicate something like heat emergencies or sometimes even really bad infections, but it's something we need to take note of. So, what color would you call these? I'll give you a chance to take a look at them here, real quick. I'd probably call him pale. He's actually probably a normal color, and he's all red. Obviously, he was screaming, so he's going to have that flushed appearance. All right, now in this video, I've attached this video for you to watch. It's how to spot a liar. A lot of times we can get cues from our patients on whether they're telling us the truth or not. Why would a patient want to lie to you? Who knows why? They might think you're law enforcement. They might be trying to hide something. You name it. But patients lie to people all the time. So it's important to understand when somebody's being deceptive. And we can't just tell through cues in their skin. A lot of times we can tell through expressions, we can tell through body language. So if we watch this in class, we're going to watch this video. If you don't get that chance, I've attached the video for you to review. All right, positional and directional terms. Now, this is important to understand. One of the most important things is the patient's left is always the left. All right, so if I'm looking at this patient right here, and they say my elbow hurts, and I'm doing my report, patient's left elbow hurts. Well, when I'm looking at them, it's my right. The patient's right is always the right. way to remember that is the patient is always right, even though it's not true. All right. The patient's left side is the patient's left side. The patient's right side is the patient's right side. When we're referring to right or left, that's what we're talking about. We can divide the patient down the middle into the midline. We call that anything towards that medial, anything away from that lateral. Another term that you need to know is proximal and distal. Proximal means towards the head, distal means towards their feet. So, and then superior also means towards the head, and inferior means towards their feet. So, if this patient right here hurt their leg right here, how would we describe that? It would be the patient's left leg, lower left leg, superior to the left ankle, inferior to the knee. You could also use the terms proximal and distal. Distal to the patient's knee, proximal to the patient's ankle. Now, another term that we need to know is anterior and posterior. Anterior is called ventral, and posterior is called dorsal. Now, anybody who fishes knows about the dorsal fin. That's the big fin on the back of the fish. We're going to make Jesus fish here. All right, there's a Jesus fish, all right? We all know on the back of the fish, there's a fin there called the dorsal fin, right? We learned that when we were little kids. Well, then why is this side called ventral? Well, the midline on a fish runs like this. And I'm going to tell it to you this way so you never forget it, because you'll always remember it. This right here is the fish's butthole. What does that have to do with anything? In a fish, their butthole is called a vent. So a way to remember that is ventral is on the belly side. The fish's vent is right there. All right, so the dorsal fin is on his back, his vent is on his belly. So you can remember ventral and dorsal that way. That's how I remember it. All right, different positional terms for ways patients are lying. Supine means laying flat on their back. Prone means laying on their belly. I remember back when I was in the Cub Scouts, we learned how to shoot BB guns, and they told us we had to shoot prone. I didn't know who prone was, but I was more than willing to shoot them. But just remember, folks, I don't get any funnier. So, all right, prone is laying on your belly. So if you're laying on your belly shooting a rifle, you are in the prone position. If you're laying on your back shooting a rifle, you're in the supine position. Not a real effective way to shoot a rifle because you can't aim at anything. Then this area, this right here, is called the lateral recumbent. Lateral recumbent is laying on their left side. This is probably how most of you sleep. Whenever we place a patient in this position, it's called the recovery position. We face them laying down there. Now, something for you to think about. Why do we put them on their left side? I'll give you a second to think. There's actually two reasons. One, if they're laying in a lateral recumbent position on their left side, their left lung actually has a little more volume than their right lung. So if they're bleeding or something's running into their lung, by putting them on their left side, we have more room to fill up and less chance of them asphyxiating. The second one is if you think about the back of an ambulance. All right, so that's looking in the back door of an ambulance. This is the jump seat where the paramedic's sitting. This is where the cot goes. All right, so you got the paramedic sitting here. He's taking care of his patient. Here's your patient. That's his head. There's his feet. All right. So if he's laying like that, paramedic can take care of him. If he's laying in a lateral recumbent position, on his left side. He's facing the paramedic, so the paramedic can take care of him then. If you put him on his right side on the ambulance cot, he's staring at the wall. Paramedic can't see him. There's also more of a chance if they take a corner too tight, the patient can slam into the wall. So that's why we have the lateral recumbent position on the left-hand side. All right, semi-Fowler's position. This is usually how we transport patients. There's usually two choices for transporting a patient. We very seldom transport patients laying on their side. We either put them flat on their back in a supine position, or we have them sitting kind of seated, half seated. That is called semi-Fowler's position. All right. Semi-Fowler's is usually the position that we put patients in to transport them. What about prone? Do we ever transport patients in prone? In general, no, because it's too hard to evaluate what's going on with them. But interestingly enough, something they found with COVID patients in the hospitals, if they place them prone, it's easier for them to breathe. I'm not sure the reason for that or what the etiology is behind that, but it's an interesting fact when you're talking about patient positioning. You used to never put anybody in prone position. Now, all these COVID patients are being placed in prone position. All right, now, abdominal quadrants. These are very important. I'm going to tell you right now, there's a bunch of questions on these on the test as to what is where. But what we do is we divide the abdomen into four pieces. And we have the right upper quadrant, the left upper quadrant, right lower quadrant, and left lower quadrant. Now, this is the patient's what side? That's right, it's the left. What side is this? It's the right. That's why this is right upper, right lower, left upper, and left lower. All right, so that's the four quadrants. But we want to look and see what's in these quadrants. All right, we're going to go through these fairly quickly. The right upper quadrant, which would be right here, because this is the patient's right, is mostly liver and gallbladder. There's some pancreas, some small intestine, some large intestine, but generally, if a patient complains of pain in the right upper quadrant, we assume it's liver or gallbladder. Left upper is mostly the stomach and the spleen. They're not going to complain of pain in this quadrant from their spleen because their spleen actually refers pain to their left shoulder. But usually pain in this left upper quadrant is usually stomach in nature. Right lower is mostly intestine. We've got the large intestine here. This is large intestine, a portion of it. We've got a whole bunch of jumbled up small intestine here. But right down here on this little hangy downy part, that little hangy downy part is a part called the appendix. Everybody in this room has heard of the problem with the appendix. Well, what happens with an appendix, it can get infected, it can get swollen, it can make people sick, make people have a tremendous amount of pain. So an appendix, when it's swollen up like that, causes them a lot of pain, and they almost always complain of pain in their right lower quadrant. So if you see a patient with pain in the right lower quadrant, we need to suspect appendix. Then finally, left lower. Left lower, there's not a whole lot there. Intestine and large intestine. That's really about all that's there. You don't see patients with pain in the left lower intestine a lot of times. If you do, it's usually constipation. Now, all those guts that we looked at are actually the digestive system, and it's important to know these parts. The esophagus is the food tube. It sits directly below the trachea and the throat. It closes up most of the time, except when we're swallowing. There's a little flap portion that hangs over the top called the esophagus that closes it off, or closes off the trachea when we swallow. That leads down to the stomach, which is a bag-shaped structure for digesting food. It's full of acid and enzymes, and it helps to grind our food up into a paste. Then from there, it goes into the small intestine, which is all this wiggled up stuff, where most of your nutrient absorption takes place. And then finally, the waste products, what's left, goes into the large intestine here and makes a trip, it goes in over here, and it makes a trip up and around the whole time drying it out. This is where we recover extra water because you have to have water to act as a lubricant for your digestive process. So by the time, whenever we create waste, it should be good and solid. That's really the quick and dirty of the digestive system. We're not going to spend a lot of time on it because you guys really should pretty much know that by this point. Then finally, the urinary system. The urinary system removes chemical waste from the blood and helps to balance water and salt levels. And it's made up of three parts. It's pretty simple. You got the kidneys here. Ever wonder why a kidney bean is called a kidney bean? It's because it's shaped like this. All right, you got kidneys. Blood flows through the kidneys, gets filtered. Waste products gets filtered out, and the waste products go into the kidneys, and they travel down these tubes called the ureters. They're just a tube that runs from the kidney to the ureter, and then we have a bladder down here. This is where our urine is stored until we're able to go and void it out. That's basically all the urinary system is. It helps us to balance our water levels. It helps us to balance our salt levels. In younger people, salt levels aren't such a problem, but in older folks, they definitely become that. All right, so if you have any questions, feel free to ask me. I'll be glad to help you out, but I figured the easiest thing to do was break this down into different pieces. That way you're not trying to sit through an hour and a half of lecture. All right, thanks, guys. Bye.